All right, hello, advanced class again. We're going to insert a single lumen airway. This happens to be a K-LDT airway that we're going to insert. We're going to pretend that it's in its package. I don't know where the package has gone out all these years, just to keep it sterile. So the first thing we're going to do is take our BSI. It's on. We're going to ensure that our patient is hyperoxygenated. So we're going to measure an OPA, insert an OPA. David's going to help me. This is hooked to oxygen, and he's going to hyperoxygenate the patient. Not necessarily a fast rate, but we do have on good oxygen. Another one of the strategies that is being used is putting a nasal cannula on, and just if they're spontaneously breathing, put a nasal cannula on at 10 to 15 liters a minute and kind of let them hyperoxygenate themselves. So I'm going to check my equipment. Again, this is in the package device, we'll say. This is the K-LDT. It is, this is a 4 and number 4. Most adults are number 4s because number 4 is from 5 to 6 feet tall. 3s are 4 to 5 feet tall. 2.5s, we're into inches, 41 to 51 inches tall, and a 2 is 35 to 45 inches tall, and a 5, which is a size bigger than this 4, is over 6 feet tall. So it also has the amount of air that can go in there, so that's a good thing. This says 60 to 80, so I'm going to inflate this cuff. Again, it is in the package. Inflate it, check these cuffs for leaks. I don't feel any leaks. I am going to lubricate this. Again, I am not going to get the lube on the airway holes. So we're going to lube it with a water-soluble lube. This has a blue line. This blue line, I'll show you what we need to do with it. So I think he's hyperoxygenated. Okay, we're going to take out the OPA. We're going to put his head in sniffing position. I'm going to do a tongue jaw lift. This blue line goes to the corner of his mouth, and then as I go back into the hypopharynx, I'm going to turn midway and go all the way down to the end there. So go ahead and we're going to ventilate. I put in about 80 mils of air. We're going to try to ventilate, and if we aren't able to ventilate, we're going to pull this back until it's not being obstructed and we have nice, good ventilations without problems. So we do. Now I'm going to go ahead and auscultate again. First the gut, and then the right lung, then the left lung. So gut, right, left. And I hear no gut sounds, and I hear good bilateral breath sounds. Now again, I'm going to use a secondary device. We've already explained the end tidal. It's great to have an end tidal on your monitor. That's the best. This is a colorimetric one, so we're going to use it this time. So we're going to look for our yellow color. Now with the Kings, you do not have to secure them, but it's not a bad idea as the pre-hospital environment is inevitably a little bit difficult. So we're going to try to use this Thomas securing device and secure it. There we go. So I'm going to look at that yellow. I can use, again, it's not been shown to be as effective as it is for an ET tube, but esophageal detector device, have to mention. And we're going to assess our patient. SpO2, end tidal readings, make sure he stays sedated. Well, he's not sedated. Make sure he stays unresponsive. Continually assess any movement or anything. We're going to assess long sounds. Make sure everything stays oxygenated and ventilated. Okay, that's it. Thank you, David.